Hi, I'm Mike Chartrand. This is Varicocele Surgery Failure, Part 4, My Story, Part 8, from 2009 to 2013. It's about photos, abuse, and denial. Uh, so, Dr. Creighton had recommended against spinal fusion, and I did not know what to do, so I just came home. I was out of my savings. I was desperate because I was unable to work without provoking my pain. I tried to work night work in group homes, but eventually I could not even do simple household chores without provoking my symptoms. I guess I first want to put on this table of contents for my other videos before I get too far into things and forget. I've forgotten some other videos, but you can always look up varicocele surgery failure part 2, and I'm trying to update that table of contents as I go along for further videos. So I could hardly work. I tried to work in group homes. The Society for Manitobans with Disabilities helped me to get work placement working in a group home, working nights. But after going up a small flight of stairs, I began to throw up violently, and soon I could not work at all. Then they helped me recommend a wheelchair. Tried to help me to get a wheelchair, and I'm leaving that story out. I might tell in another video. I got to the point where I could not slice a tomato or butter my bread. If I stood too much or walked too much, I would throw up. But I was always uncomfortable. Sometimes I would throw up and have diarrhea at the same time. I applied for disability and tried to work. I was originally denied disability until I was accepted on the basis of somatoform disorder. I saw a psychiatrist who basically said that I had become focused on my hip problems and that I was not malingering or trying to get out of work. He said my pain was real but also psychological, as I understand it. In February 2012, I got a video camera and used it to see between my legs under my scrotum. The skin appeared red on the right side. The scrotal skin from the left side was moved over onto the right side, and the left testicle and scrotum sat in the middle, displacing the right testicle and scrotum. At this time, I was lying down, so I did not know that the skin was being bunched up there and causing pinching and chafing problems. I took the photos to Dr. Creighton, who only took a casual glance, but said that he could not help me anymore or see me anymore. Because I was standing and sitting at the doctor's appointment, I suddenly began to throw up violently in the car on the way home. This had happened often before, but never in the car. That was my main difficulty, which I was discussing with my doctor. I still cannot stand or sit much without aggravating the levator ani muscles. My hair was long at the time because I was exploring my Aboriginal roots and culture. This would limit a person's opportunities for employment, but I was not working anyway. Winnipeg has been called Canada's most racist city. My last name is a very well recognized Métis name in Winnipeg. I don't know that I am related to David Chartrand, president of the Manitoba Métis Federation. Not that I know of, I'm not related, but it is the same last name. I waited 20 minutes, then drove my car safely into the emergency department. I parked my car in front of St. Boniface Hospital, between the ambulance entrance and the emergency entrance. A very young security guard came and told me to move my car. I was speechless, and he just walked away. Then he came back and asked me if I needed to see a doctor. I replied, yes. He asked me to park in the front emergency parking. He told the nurse that he had seen someone driving erratically in the parking lot at the back. The nurse told me that I was being admitted and that police had been called and that I was not allowed to leave. I said, thank you. I was not impolite in any way, and I was too tired to argue the point. I said that I was coming from my doctor and that I had scar tissue under my scrotum and that I needed to recline or lie down. They brought an upright wheelchair, which I refused. And by the way, my car, I had an old Buick where the seat moves very far back and very far up. And I had actually even talked to police officers about the way I drove, which was safe. but I was reclined and practically lying down while I was driving. They brought an upright wheelchair, which I refused. The nurse said they didn't have anything where I could lay down. I was polite and not yelling in any way, but I told her firmly that it was a hospital, and of course they did. When I opened the door to look at the wheelchair, they stuffed it between my car door and my car. It was cold outside, and I asked them politely a number of times to remove the wheelchair so I could close the car door. I was cold and nauseous, and very tired and in great distress. When they would not remove the wheelchair, I began to push my car door out because pulling the car door in would hurt and strain my abdominals, which were already sore from vomiting. So the spring on the door was slamming it into the wheelchair, and they removed the wheelchair. Then they brought an ambulance stretcher. I got in myself, and 8 people carried me into the hospital without any sort of a struggle. Just inside the hospital was the same wheelchair. I pleaded with them not to put me into the wheelchair. I did not struggle, and I could not struggle because my abdominals were sore. Instead, I pulled my stomach in to protect myself from the pain. The way they were carrying me was hurting my abdominals. In the report, the nurse said that she put me in the wheelchair to protect me because I was struggling against the staff on the stretcher, and that she thought I was a danger to myself. This was certainly not true in any way. I could not struggle at this point without hurting myself, and I was too weak, nor did I have any reason to struggle against the staff. I was on a stretcher and laying down. Her report also said that I was muttering about God, which was certainly not true in any way, unless I said, "Oh my God." This is how racism works. If you look at someone differently, you characterize them in a certain way. You also make the report in a way that justifies abuse. You accuse the victim. If I was working and wearing dress clothes, would I get microsurgery for my varicocele? When the 8 people left, I slid out of the wheelchair and onto the floor. The same 8 people came and brought me into a cold room. I was in that room for 8 hours and had 2 glasses of water. I eventually got a second blanket, which were not very warm. I was so tired and sore I could hardly speak. I was breathless, as though I had been punched in the gut, and they tried to ask me a lot of questions just after they abused me. They were angry and frustrated because I did not answer their questions in any detail at all, but only in basic phrases. It was all I could do. I was out of breath. I could hardly speak. I told them about the scar tissue. It's like being punched in the gut. I told them about the scar tissue on my scrotum and how I threw up as a result of going to my doctor, who did not know why I was throwing up. I told him that it happens periodically, and when it does, I needed to get warm and I need to get hydrated. But I was breathless and my words were unclear. They took a blood test and told me that I was dehydrated. Thank you. When the doctor came to look at my scrotum, he removed the blanket and lifted my left leg, and I began to shake violently and pant like a dog uncontrollably. This had happened to me twice before, once when I did a triathlon in Lake Manaki, and once at Pasu Falls waterfall. You should note that in each case my testicles got cold quickly. I actually walked away from the waterfall and it stopped, and walked towards the waterfall and then it would happen again. Eventually they sent me to a psych ward, which said that I had not been hallucinating, and sent me home once I recovered. My doctor had told me not to go to the physiotherapist that had recommended the Kegels exercises. He said they were putting strange ideas into my head. But the doctors at the pain clinic recommended those same physiotherapists because they specialized in pelvic floor issues. I went back to that physiotherapist, and she assessed my pelvic floor strength as 2 out of 5. This was the same strength that it had been at in 2008, and so it had been the same for over 4 years. I went to the walk-in clinic doctor who referred me to a urologist about scar tissue. This urologist, Brenda Hildebrand, did not address the scar tissue issue. She only said that the varicocele would not have any impact on my walking. She had a resident doctor in the room at the time. When I said that was not the reason I had come in to see her, I was asking if I had scar tissue under my scrotum and how it got there. if that would have any effect on my walking. Uh, so she was saying the varicocele wouldn't have any impact on it, but she wasn't addressing whether there was scar tissue. And she never did address that issue, but she did recommend the same physiotherapist that I was already seeing for the pelvic floor issue. Now, she's passing it off onto the physiotherapist and the spinal issue, which is a legitimate issue. But she's in denial that the varicocele could be causing this difficulty. Now, compare this Manitoba urologist to Dr. Keith Jarvie's articles on common scrotal pain. Common scrotal pain is a real thing, and I should have been diagnosed at that time. I should have been referred for microsurgery at that time. 2 weeks after seeing Brenda Hildebrand, I taped under my scrotum to bring the right side back into the center and went back to the physiotherapist. My pelvic floor strength increased to 3.5 or 4 out of 5, so I had doubled my pelvic floor strength just by taping under the scrotum within 2 weeks between those appointments. Taping became problematic, and now I use a ring of non-stick elasticy tape. If I limit my walking and use this tape, it keeps me from vomiting and diarrhea. The left side does not displace the right side as much, but it is better than using tape or doing nothing. My doctor at the walking clinic agreed that Brenda Hildebrand did not answer the question about the scar tissue and why it was there. She referred me to Dr. Moharib, who did not address the question I was asking either. The notes from my walk-in clinic doctor clearly described the expanding and contracting in my scrotum and about the scar tissue, which were my issues. So she understood it. You can see from this video that I'm doing, I have some ability to describe my problems. Although I may be detailed and boring, Dr. Moharib puts in his notes that the symptoms I was describing were strange. During my visit with Dr. Moharib, I was very conscious that he might not want to answer my question. I was very clear, is there scar tissue underneath my scrotum? I would repeat. He would go off topic, and I would simply repeat, is there scar tissue under my scrotum? He went off topic, but did eventually say that, went back and forth. He eventually said that my pain might be from when Dr. Milner suspended my testicle during the surgery. So I hadn't heard about this before. Dr. Moharib did not put this, though, in his notes or his letter to my walk-in doctor. Dr. Moharib was very rude, saying in a very polite way, "Can I help you out? Do you need any help getting out?" I was very polite with him and very controlled also, despite the fact I knew he was obfuscating. He was the second urologist to avoid a simple question, is this scar tissue? Now I'm skipping forward in time a little bit to a further urologist. I tried to see, but this time I did not use Dr. Milner's name because I was afraid by this time that the urologists were trying to protect Dr. Milner. My new family doctor had suggested that some of my pain might be because Dr. Milner had accidentally cut a nerve. I just wanted to ask the doctor about that, what the symptoms would be. And I knew what kind of surgery was done, and about further surgery. I think I had a copy of the surgery report with me with his name blocked out. But he would not answer any questions if I did not give the name of the surgeon. I was very polite during that appointment, but the doctor got very angry when I would not tell him the name of the doctor who did the surgery. I thanked him and left. I was not impolite in any way, and he was very angry. "This is not a game," he would say. I was not playing a game. I had my reasons, and I was polite. So I'm going to end that video there.